Thank you so much for attending this exciting lecture. Become a super doc with thermal vision and laser powers, presented by Dr. Yuki. First, let's go over the disclaimer. Everything presented in this lecture is the sole opinion of Dr. Yuki, that's me, and no company can be held liable for the contents of this presentation. And no particular company is endorsed or implied in this lecture, and it is presented for educational purposes only. That's it for this disclaimer. Now let's get to the lecture. Who is Dr. Yuki? Well, I do eat junk food. Here's a recent formula that was shared with me, and that is to mix a non-branded vanilla shake with French fries. I have no idea what brand of French fry it is, but it is so yummy, and yet I know it is so bad for you. I also received my DVM from Colorado State University. I have 48 years of pet industry background. Here I'm giving away prizes at a conference, and you may have seen me at all kinds of different conferences throughout the world. I am a mobile laser therapist and a laser acupuncturist. I'm demonstrating here the absolute wrong way to laser a horse. I also sell over 33 lasers from 13 different companies and also a lot of other veterinary equipment. I also authored 4 laser books and created a laser therapy app. Well, that's the boring stuff, and now for something more interesting. Here's something you may not know about me. It's us cruising. But we absolutely hate formal nights. So here we are on formal nights with a nice, cozy, happy pose. Here's another one. The photographer simply didn't understand what we were doing. This isn't the normal poses that they take on cruises. We're also the world's worst selfie takers. I am still so bad at this. But I think I'm getting better. Now you can see more of my forehead. And Mike, he's always so kind to help hide my blemishes. So here we are at Cozumel, Mexico, and you can really see that he's doing a good job hiding what was on my face. But we do always like to have fun, and we laugh, and life's short. It's all about having fun, isn't it? Here's a brief overview of what we will cover today. First, I want to talk about preventative medicine. Why is it preventative medicine? Because your patients can't tell you where it hurts, especially on stoic patients, but now we can see problem areas before the patients even start to show any symptoms. That's preventative medicine. And we can also help increase your revenue. That's right, I'm going to show you how to increase your income, because now you're going to have increased owner compliance to explore more diagnostic treatments and to accept your other modalities, especially when you can show them the areas that needs more workup. And finally, we can target the treatments. That's right, we know exactly where to treat because we can visually see exactly where their pain is, and this is for targeted, pinpoint, accurate treatments. And now you don't waste any time lasering in areas that actually don't need it. In detail, this is what we will cover. First, why do laser acupuncture? And some of you in the audience may know who that is. That is the infamous Dr. Alan Schoen. Anyway, so why use laser acupuncture? Well, there are patients that you'll want to use laser acupuncture instead of needles. Also, we're going to use what kind of conditions that calls for laser acupuncture. Plus, how about some benefits of using laser acupuncture versus needles? Next, the thermal vision superpower. Do you want to increase your healing senses by 25 to 75%? Yes, I'm going to show you how to do that. And I love to show you how you can see problems before any symptoms shows. This is preventative medicine. And we also know that some animals are very stoic and will try to hide where their pain is. And how about being able to pinpoint problem areas? You can visually see them with your thermal vision superpowers. Next, we're going to increase revenue because we're going to increase not only laser therapy revenue, but other diagnostic revenue as well. And we'll also offer take-home rental lasers, and that also will increase your income. Finally, we'll go over some conditions. That's right. How about some conditions to use with both your powers? That is what we're going to cover today. Why use acupuncture? This lecture will not go into the mechanism of laser therapy or acupuncture, as I have other lectures that covers this topic, but I will introduce you to some reasons to offer this laser acupuncture modality. First, it is super fast treatment. It's about 15 to 60 seconds a point depending on the laser that you use. That's a lot faster than traditional needles, which can be 20 to 40 minutes long. There's also no needles to track. That's right, you don't need to count the needles anymore, especially like on a ting points on a horse. If they stomp their feet and those needles go flying, you have to make sure that you pick them all up. Next, what about needle expenses? None. There's no more expense for having different size needles on hand for all your different size patients. And finally, what about needle-phobic patients? There are some patients who simply don't like needles. These are for both animals and humans. I certainly don't like needles. Let's continue with why we should use laser acupuncture. How about bleeders? There are some patients who are prone to bleeding, especially if they're on any kind of blood-thinning medications. There's no worry about bleeding when you're not using needles because it's totally non-invasive with laser acupuncture. Next, how about ouchie points? There are definitely some points that are really painful, and we can avoid this pain yet treat it with this laser acupuncture. No pain. Next, how about some dangerous points? Some points can be very dangerous if you go too deep, like right over the lung lobes and you go perpendicular into them. You certainly don't want to cause a pneumothorax or anything like that. So we can avoid any of these dangers by using laser acupuncture. And finally, how about squirmy or aggressive patients? Some patients are too wiggly like young little puppies, or they may eat the needles, or how about using them on aggressive patients? Would you really want to place needles on this dog, or you have to observe them for 40 minutes in close range? I think not. So lasers can treat over 300 conditions. That's right. So laser therapy and laser acupuncture, it's an ideal non-invasive modality to help reduce pain, inflammation, swelling, and plus speeds up healing. You can use it for like arthritis, DJD, IVDD, hip pain, elbow pain, pre and post performance, kidney disease, heart disease, and so much more. Plus, some lasers have the blue and violet light. That's right. These lasers can help with things like antibacterial properties and MRSA with the blue light. And the violet radiance can help speed up that fight against fungal infections. So over 300 different conditions. It's amazing. how to use laser acupuncture. Well, it's very simple. We use them instead of needles by simply placing them on the point you want. It's the exact same point as the one that we would use if it were needles, but we just place it on them for 15 to 60 seconds a point. That is it. There's no need to push on it. It just uses the power of the light to penetrate deep into the acupuncture point. We can also use it along with needles. So while keeping the needles in place, you simply laser over the same point as the existing needles. You may be able to see that needle hub right there, the needle tip, and the laser is just being placed right next to that needle. And finally, you can use it with electric acupuncture for those resistant cases. So here it is showing it with a clip of the electric acupuncture on the acupuncture needle itself, but you can also see the point of the laser right there as well. So this is great for resistant cases. You can use the laser you already have and just follow the tips and recommendations from your laser rep. And if you don't have one, I do have this lecture on how to weed out the bad lasers with questions that you need to ask every rep. And this is to help save you money and to keep you from falling prey to those false sales tactics, because did you know there are over 500 lasers being sold on Amazon right now? It can get very, very confusing. So please ask me for this lecture. Just visit my booth or write to me for this valuable weed out the bad lasers. Next, let's cover thermal vision superpower because it is up to 75% more sensitive than your fingers, meaning this thermal device can sense heat better, 75% better than our own fingers, and 25% better at detecting cold areas. It also reveals hidden problem areas before any symptoms show. That's a superpower. And you can visually see the areas that need treatment so you don't waste time or effort treating areas that don't need it. This is targeted treatments. So how does thermal vision work? Now this lecture is not going to go into super deep detail on the mechanics of it, but I will briefly say that it is a non-invasive modality, nothing that goes into the animal itself. It actually detects emitted radiance from the patient. That's important because this is really cool. Nothing is transmitted back to the patient, so it's not harmful. It's not like an X-ray that we are subjecting the patient to a lot of harmful rays. Not with thermal vision. That's right, nothing is transmitted back to the patient, so you can take as many images as you want because it is the device that is detecting what is being emitted from the patient itself. It is super fast, it's simple, it's easy to detect minor differences in heat radiance. I want to show you some sample images so you can kind of get a grasp of what digital thermography looks like. So here we have arthritis. You can visualize areas that are affecting you due to pain. See where all the white is? The white is the hottest area. So you can see near that joint of that thumb, it is very, very painful. And this patient really does have arthritis in that area. So it's so nice to be able to see where the painful areas are. And here's another sample of a painful area on the bottom of the horse's hoof. You can visualize the pain. You can see how much redder it is on that one side of the hoof wall compared to the other. The blue is colder. The greens and blues are colder. The red and yellow is hotter. So it really does show you the areas to focus your treatment or your shoeing or whatever you're going to do. It visually shows you where the problem area is. Next, how about hidden areas? You can visualize the areas of pain, even if you have a really stoic patient. And you can also find areas that you won't be able to know if you don't palpate. If you have an aggressive patient and you can't touch them, how are you going to know? Well, here in that circled area, there's that little focal area of red. That is emitting heat, which means that there might be some pain or infection going on there. So it does reveal hidden pain. Here's some more images I like to share with you. Targeted treatments. Now you can see exactly where you need to focus your treatment. So you don't need to do the non-painful areas like over the neck or the shoulders. Look at where all the painful areas, all that white, red, you can see where that painful is. So if you're going to laser, you wouldn't waste your time to laser around the neck and shoulder area. You would concentrate instead on the white, red areas that need your attention. Next, you can analyze stance. There's no need to purchase another equipment to analyze your stance. You can use the same device, and this is right here, the footprints of a dog. Once you have the dog standing there, you remove the dog and you can see where the dog is placing more weight. It's similar to those machines they have at those feed stores to analyze your pain or where you're putting more weight on. And so it's really nice to be able to see this. You can also do this on a moving animal as well, because it will leave a heat signature on the floor. So it's really nice that it can do more than one thing. And I really like this next one. It detects issues much earlier than a standard mammography can. Digital thermography can detect cancer years ahead of the standard methods. Now, I have terrible health insurance. It doesn't cover this great digital thermography. Instead, it covers the standard squish radiographs that emits back terrible radiation back into my body. Now, now you can see from the digital that the right breast has some abnormality going on. It's got some cancerous growth, because cancer needs a lot of circulation. It's got a lot of heat going to it compared to that left breast that has no abnormal growth. But now that I have my own thermography camera, I can shoot myself and do it since my insurance won't. I love having this modality to help detect cancers much earlier than traditional radiographs can. Here is a sample case of an inexpensive quick scan. Now, this female spayed 8-year-old mixed breed, 20 pounds, was presented for this soft fluid-filled mass. The owner didn't want to do a needle aspirate because the patient was very wiggly, fussy, and she didn't want to spend any money on a needle aspirate. She didn't want a full workup because we suspect it's going to just be a benign lipoma. But since I had the thermography camera, I just took a picture and take a look here. The thermography showed that this area was cooler. There's no active blood vessels and there's no circulation in that area of concern. So that's good, because if it was cancerous, it wouldn't be that dark green color. It'd be more like that breast tissue and have a lot more things going on. So no further diagnostic workup was ordered for this patient, other than to just keep an eye on it for any kind of changes of growth or texture. So this is a very simple, inexpensive, non-invasive scan for a quick peace of mind for the owner. Isn't that great? Here's another case of compensatory or hidden pain. This is a male spayed 9-year-old mixed breed, about 50 pounds. Was actually presented for hind limb lameness and was a candidate for laser therapy. You can just kind of see where the pain is. It's all red and white on the hind limbs there. But thermography also showed that the patient had pain, compensatory hidden pain along the back there. That's why we take more than one view. But there it is, that red area showing that we've got some back pain. So laser therapy treatments included not only the hind limbs, but also this hidden back pain. Now, further diagnostics were ordered for this patient, but this is a simple, inexpensive, non-invasive scan for the complete treatment for the patient. We would never have known about that back pain had we not used this. Did you know that many different kinds of animals can be helped with thermography? See, we can see a horse here with the different differences in radiance on both sides. That indicates an area of concern. This is the rear, right over the tail. You can see on the left-hand side how much more heat there is compared to the right-hand side. So that indicates something is going on that left-hand side, comparatively speaking, between the left and the right. Here is an elephant. This is using a different camera, but depending on the resolution, this kind of all shows one temperature instead of all the differences. So although I won't go into it, you can ask me at the booth or email me about the different types of camera, but you can kind of see that some cameras doesn't have enough resolution or differences in temperature. This one shows it a little bit better. You can see the differences now in the temperature. So we can do elephants, and we can do a lot of wild animals because we don't need to be right next to them, which is great. Birds are really much better with less touch, and you can evaluate them from afar, which is wonderful. Here we see it on a goat. We can visualize abscesses and tooth problems. Even in whales and other wildlife, you can see on this goat that there is something going on his right side there. So it is a very useful tool to find infections and abscesses in teeth. And wow, can you use this to go fishing? Maybe. But anyway, this is also done. This is in the water, but being mammals, they have a different temperature than the water. You can actually see them. Imagine the possibilities of uncovering hidden problems from afar. How your powers can increase revenue. That's right. Well, once you show your clients the hidden areas of concern, you can recommend further diagnostic workups. For example, you may want to order some radiographs to explore in detail any hidden bone structure changes or to project future changes. And what about ultrasound? That's right, diagnostic ultrasounds to help find hidden masses or other causes for the change in the heat radiance. And third, you can sell laser therapy packages. It's much easier to sell them, especially after the owner sees the benefits and the results. With thermography, you can show the before and after to show the improvements as well. Next, we have more frequent office calls and rechecks because they have to come back to see how that process is doing. And thermography is a great way to show the clients how we're doing or if we maybe have to change up the routine. And finally, we can also have rental lasers to increase income. I would recommend at-home rental laser treatments. Now, I do have a lecture on how to grow your rental laser business. If you're interested, it's this one, Grow Your Business with Rental Lasers. There simply is not enough time to cover this topic in this lecture, so I do have this lecture. If you would like it, just ask me for it. There are over 300 conditions that you can use with laser acupuncture, digitherm. It's pretty amazing. So first, all pains such as arthritis, tennis elbow, DJD, IVDD. There's too many to list, but you get the idea. All aches and pains. What about swelling, inflammation, skin issues, MRSA? A lot of skin things can be treated with laser therapy. The acne even, these are skin issues. Pyoderma, all of that can be addressed with laser therapy. How about bacterial infections? If you have the one with the blue light, you could do bacterial infections. You can treat fungal infections with the violet light. Helps with bone growth. Ear infections. Have we seen any pets here with ear infections? That blue light is wonderful for treating that bacterial growth in there. Next, wounds. Yes, wonderful for treating wounds. It heals it in half the time. This all includes post-op surgery, increases the bone matrix in half the time, renal disease, trauma. Next, we also have ligament and tendon injuries, back, neck, shoulder, all of that. How about dental infections, cysts, laminitis, microfractures, and even cancer? Cancer is a highly controversial topic, which once again, I don't have enough time to cover in this lecture, but some doctors are definitely starting to use it, and more studies are coming out for this use. Next, we can also help with heart disease. Lasers can help make the heart stronger. It helps with thyroid disease, diabetes, navicular disease, digestive disease, sinus allergy disorders, just so many more. And finally, how about hormonal issues, feline hyperthyroidism? Diabetic neuropathy is huge. That pain of diabetic neuropathy can definitely be helped with both laser and laser acupuncture. So which power do you want to adopt? There's so many devices, both on laser and digital thermography, both. It starts from $30 all the way up to $200,000. So that's a lot. So here's just a picture of some of the popular lasers that are available. And there's also a whole slew of thermography equipment. Many of them are for industrial uses and has limited temperature ranges, and it's not calibrated nor have veterinary specific software, but you have a slew of them. If you would like some input on what to purchase, I can go over that as well, but obviously not covered in this lecture. It would be in another one. I do have this lecture, however. It is how to select your laser wisely. If you would like this lecture, please just ask me and I'll be happy to send it to you. I want to go quickly over some camera features to compare because I think this is important when you are trying to choose your next thermography camera. So first of all, the American Academy of Thermography creates standards, and they state that the maximum deviation should be plus or minus 1 degree centigrade. So that's the first thing that you want to check for is the sensitivity. In comparison, just want to let you know that the sensitivity of the Digitherm exceeds that of standard. So on the vet side, it is plus or minus 0.05 degrees, and on the medical side, it is 0.02 degrees, which is far superior than the standard of the AAT at plus or minus 1 degree Celsius. You also want to check for this because you need good resolution to see everything. You don't want to miss some important structures. Now, AAT recommends 640 by 480. You can check to see if your thermography has that. Now, in comparison, the Digitherm has 640 by 512, so it does exceed it. There are some cameras that are even better than that, but I just want to show that to you. Also, how are the points? Some cameras can only shoot one area. The Digitherm can do over 300,000 points of measurements. To be exact, it's 327,680 separate points of measurement. That's a lot. You don't need that, but you definitely need more than one to compare it with. Next, is it for vets? Is it veterinary specific software that actually keeps track of your patients and can send reports? Because there are industrial cameras, and that's great for finding leaks. It's used in automotives, plumbers, appliances like pizza oven. They have extremely high range in temperature, but we don't need that for a living animal. But you want to make sure that they've got the software, because a medical software will actually keep track of your patients, and it can create those very important reports that you can send home and keep in your medical records. It is a professional device, and you are charging for your service and the camera uses, so it should look like a professional equipment with professional results. Here are some devices I want to compare. If you look on Amazon, there's hundreds of different models available, but you need to compare the specs. Now here's one that is an industrial one. And this one is a $20 item. It is industrial. It's used for 1 point only. It even has extremely high measurements. Some of them goes over 1,000 degrees, although you don't need that for living tissue. It shouldn't ever be that cooked. Anyway, so this is a simple $20 item. It really doesn't show you in comparison the differences visually, but they do make them. This is completely industrial. Second, we have this camera. It is actually a $600 camera, but it is extremely low in resolution with only 256 by 192. This is far below the AAT standards. I don't like it because if you can see, it just shows blank areas, the same color in one area. I'm losing a lot of detail, and you're going to miss some important structures. This one is extremely popular, and I actually started with this one to begin with. It is the FLIR camera that attaches to either your Android or your Apple phone. The problem with this one is, once again, that sensitivity is very low, I guess you would call it, meaning it's a plus or minus 3 degrees to 5 degrees when AAT says it should be plus or minus 1 degree centigrade. So you will definitely miss a lot of structures, especially if you're using it from far away. My particular one kept falling off the bottom of my iPhone. Now you can put it on your iPad. I believe the third generation improved on it, but still it doesn't have the resolution I need. Plus the battery life is extremely short. It's only got a 40-minute battery life. Others have like a 2-hour battery life, so you won't be able to use it all day, but still, it is a good starting point if you don't have anyone, but know that it will miss some structures. And finally, if you're one of those people that absolutely must have the best of the best, well, there's no other choice than the Digitherm cameras because it exceeds the AAT standards, and it's the only one right now that has those beautiful veterinary specific software that creates those forms and reports that you can email right from the camera to your clients. Plus, when you do side-by-side comparison a month later, you can recall them up as it's all stored on the pad. So it's pretty nice. Be very careful of what you buy because there are so many available. Be sure to compare the specs, and it gives you the visuals that you need so you don't miss important structures. We also ship lasers and cameras worldwide. We know the electrical specifications for each country. So if you're from a different country, or you want to send it to a different country, or you want to bring it with you to a different country, we have those answers as we are used to shipping them around the world. Did you know you get a free laser therapy tips app? That's right. When you purchase equipment from me, you're going to receive a subscription to the laser therapy tips for free. That's right. I said it's totally free. I created this app so it makes it very easy to use your laser correctly. You can use your iPad to reach me too. So use your tablet to email me with your questions. I also sell a lot of other veterinary equipment. Just ask me. Here you can see me holding up the most cutest mini monitor. That's for EKGs and blood pressure and all that, but I sell all kinds of other equipment. I'm also here guilty of doing some anti-shoplifting. Not shoplifting, it's anti-shoplifting. I'm actually putting in a book at the library instead of taking it out. So I'm guilty of that anti-shoplifting. You can reach me by email and text support. Simply email me at dryuki@mac.com for response within 24 hours, because if you don't receive a response from me, try again, because I didn't receive your message. I will answer daytime, nighttime, evening, weekends, holidays. I've even answered on my vacation. I'm here for you. I know how important it is to get an answer when you want your questions answered. Thank you again for watching this presentation. I really appreciate it. If you would like a recorded copy of this presentation to share with everyone, just reach out to me at dryuki@mac.com. I'll also be at many exhibit hall at conferences. Just come to me and ask your questions. Now I want you to go forth and use your powers to heal. And finally, do you see that picture? That was another one of those formal nights on our cruise. We definitely like to have fun. Thank you so much, and we'll see you at the next presentation. Bye.